Welcome to Chapter 18, Gastrointestinal and Urological Emergencies. Chapter 19 in the 12th edition, and this is Chapter 18 in the 11th edition. Abdominal pain is a common complaint. There are often several causes to abdominal pain, and that can make it difficult for us to determine what the possible cause is. Also, abdominal pain can mimic other cardiovascular diseases or other concerns that we may have for the circulatory system. So, understanding common signs and symptoms related to common abdominal injuries is a good trait for an EMT to have. You don't have to determine the exact cause, but you should be able to recognize whether or not somebody has a life-threatening problem and be able to act accordingly. Remember that the abdominal cavity contains the GI system, gastrointestinal, the genital system, and the urinary system. It is made up of several different hollow and solid organs. Solid organs include the liver, spleen, pancreas, kidneys, ovaries. Any injury to a solid organ can cause shock and bleeding. Hollow organs, the gallbladder, stomach, small intestine, large intestine, and urinary bladder. If there's perforation of these hollow organs, the contents leak, and that will contaminate the abdominal cavity, and of course create an infectious process that then becomes significant to the patient and can potentially cause sepsis, leading to septic shock. So, looking at these illustrations, you'll see on the left there are solid organs, and on the right are the hollow organs and how they are placed within the abdominal cavity. Again, very significant, the liver, vascular organ, if it is perforated or damaged in any way, it can cause significant bleeding. The bile duct, which tends to get plugged with gallstones, and the gallbladder, which also tends to get plugged up with gallstones, can cause a significant amount of pain and can become life-threatening depending on the severity of the blockage. And we do see patients actually quite frequently for gallbladder stones blockage. The small intestine, and that is where most of your nutrients are absorbed, and your large intestine, where most of the water is absorbed back into the body after the nutrients have been absorbed through the small intestine. And also the bulk of the feces is created within the large colon. And the appendix, which is a currently useless tool for the human anatomy, actually potentially had a place in the past, but now what it does is it just kind of hangs out there at the end of the colon, and it waits for a possible infectious opportunity, creates an appendicitis and can rupture, and has a significant mortality if not treated correctly or treated quickly, and then they have to remove that. The esophagus has its own variations of issues, one of which can cause some significant bleeding. Diaphragm, that is, of course, the muscle that divides the thoracic cavity and the abdominal cavity. The stomach, which is the largest digestive organ for holding the food and breaking down the food, secreting enzymes and acids in order to break it down to get into the small intestine where the nutrients are absorbed. The spleen, which has several functions, many of which include filtering out the blood and also producing blood cells or assisting in the production of blood cells. And of course, the rectum, which is where the food is vacated or the bolus is vacated from the large colon. The GI system is responsible for the digestion process. Digestion begins when food is chewed. You have enzymes within your mouth that start to break down food right away. They're secreted out of the salivary glands. Food is then swallowed and travels down the esophagus to the stomach. The stomach is the main organ of the digestive system where gastric juices break down food. The liver assists in digestion. It secretes bile, aids in digestion of fats. It also filters toxic substances produced by digestion, creates glucose stores, produces substances necessary for blood clotting and immune function. The gallbladder is a reservoir for bile. Once food leaves the stomach, it travels into the small intestine via the duodenum or duodenum. The digestive juices from the pancreas and the liver mix together. The pancreas secretes an enzyme that breaks down starches, fats, and proteins. It's also alkalytic, which is important to balance out the gastric acid that is coming out. So together they create a neutral base. Bicarbonate is also produced in the pancreas that neutralizes the stomach acid. Insulin is also produced in the pancreas, and it regulates the amount of blood glucose in the bloodstream. And then the jejunum, which is towards the end of the small intestine, plays a major role in absorption of digestive products and does much of the work in the small intestine. The ileum absorbs nutrients that were not absorbed earlier. It absorbs bile acids so they can be returned to the liver for future use, and vitamin B12 for making nerve cells and red blood cells. The colon, which is the large intestine, food is not broken down and used, moves into the colon as a waste product. Peristalsis is what we term the movement of waste matter through the intestines. Water is reabsorbed and stool is formed. Then the stool passes through the rectum to the anus and is defecated. Additional abdominal organs, including the spleen, it's located in the abdomen but has no digestive function. It is part of the lymphatic system, again, a significant role in relation to red blood cells and immune system. It does assist in infiltration of blood. It aids in the development of red blood cells, serves as a major blood reservoir, and produces antibodies. The spleen, as a blood reservoir, makes it a high potential for causing hemorrhage if it is ruptured, and the spleen tends to get ruptured kind of quickly. The genital system is the abdominal space that also holds the reproductive organs, is in that area. In the male reproductive system, you have the testicles, the epididymis, vasa deferentia, seminal vesicles, the prostate gland, and the penis. And in the female reproductive system, we have ovaries, fallopian tubes, uterus, cervix, and vagina. The urinary system controls discharge of certain waste materials filtered from blood by the kidneys. The kidneys are solid organs. They sit in the retroperitoneal space, so they're technically outside of the peritoneum that houses most of the abdominal organs. It consists of the ureter, the bladder, and urethra. Those are hollow organs. There are two kidneys, one on each side of the body. However, that doesn't indicate that they're both working. In some patients or in some individuals, there may only be one kidney, and or only one kidney is actually working well. It lies on the posterior muscular wall of the abdomen behind the peritoneum, plays an important role in the regulation of acidity and blood pressure. It also rids the body of toxic waste, controls the balance of fluid and electrolytes, and blood flow is very high in the kidneys. And when there's a damage to the kidneys, there's the potential for increased blood flow or increased blood loss. Another important function of the kidney that wasn't mentioned is that the kidney also has the adrenal cortex on top of it, sits just above the kidney. And that adrenal cortex is responsible for getting us into our fight or flight mode. So it secretes adrenaline, and whenever it's stimulated, it secretes adrenaline, which creates all of those signs and symptoms that we have associated with increased adrenaline. The ureters join each kidney to the bladder, a small hollow muscular tube, one to the right and one to the left. Peristalsis moves the urine to the bladder. The urinary bladder is located immediately behind the pubic symphysis. The bladder empties to the outside of the body through the urethra. And again, the male urethra passes from the anterior base of the bladder through the penis and shares the reproductive organ. And the female, the urethra opens at the front of the vagina, is not actually a component of the reproductive organs. A normal adult forms 1.5 to 2 liters of urine per day. So you see this illustration. Kidneys, ureters, bladder, urethra. Kind of a simple system. Kidney is very complex. It filters at an enormous rate, and it's also a very fine filter and very vascular filter. One of the hardest organs that they're able to, or that they're working on still, trying to reproduce artificially. The abdominal cavity is lined by a membrane called the peritoneum. The peritoneum also covers the organs of the abdomen. The parietal peritoneum lines the walls of the abdominal cavity. The visceral peritoneum covers the organs. Any presence of foreign materials like blood, pus, bile, pancreatic juices, amniotic fluid can irritate the peritoneum, causing peritonitis, and it's very painful. Acute abdomen refers to the sudden onset of abdominal pain. It's often associated with severe progressive problems requiring medical attention. Peritonitis causes ileus, and ileus is basically paralysis of the muscular contractions that normally propel material through the intestines, so that peristalsis is halted until the threat is contained. The retained gas and feces cause abdominal distension. The stomach can empty itself only by vomiting, and it becomes a projectile type of emesis, forceful vomiting for the patient, unfortunately. Peritonitis is frequently associated with nausea and vomiting as a result. Peritonitis is also associated with loss of bodily fluid into the abdominal cavity, and the patient may present with tachycardia and hypotension as a sign of shock. Diverticulitis is inflammation of small pockets and weak areas in the muscle walls of the intestine. Fever may be present, and cholecystitis is gallbladder inflammation, where fever may also be present. An acute appendicitis is the patient's temperature may be within normal limits. However, once the appendix ruptures or begins to rupture and develop peritonitis, then the fever starts a little bit more strongly within the patient. This is an image of inflamed diverticula. So there are these pockets that develop. Diverticulosis is the condition that's called for these little pockets that develop within the colon. And whenever things get trapped inside these little pockets and start to fester, basically inside there, that's when they develop what's called diverticulitis, which is very painful. There are two different types of nerves that supply the peritoneum. You have the abdominal pain that can have many different qualities. The parietal peritoneum is supplied by the same nerves that supply the skin of the abdomen. So it perceives pain, touch, pressure, and heat, and cold. It can easily identify and localize a point of irritation. The visceral peritoneum is supplied by the autonomic nervous system. So nerves are far less able to localize sensation, and patients will not be able to describe exactly where the pain is, and that's called referred pain. Depending on the illness, several have their own components of referred pain. And here's an example of cholecystitis and how that causes referred pain. So the injury is actually within the gallstone or the gallbladder, or gallstone caused within the gallbladder itself or within the bile duct, and creates a significant amount of pain in that area. So the right upper quadrant and in towards the side, the axillary area. But the referred pain actually goes up and into the shoulder, and that's because of the autonomic nervous system's association with the nerves. Common causes of acute abdomen include ulcers. So the protective layer of muscle erodes following acid that eats into the organ. Causes of peptic ulcers include Helicobacter pylori infection. That's an actual bacterial infection that can be treated. Chronic use of nonsteroidal anti-inflammatory drugs, alcohol, and smoking. If the erosion is severe, it can lead to gastric bleeding. Peptic ulcers affect men and women equally, but occur more frequently in the geriatric population. It's described as burning, gnawing in the stomach that subsides or diminishes immediately after eating. Nausea, vomiting, belching, and heartburn are common symptoms, and some ulcers heal without intervention. In gallstones, the gallbladder stores digestive juices and waste from the liver, and the gallstones may form and block its outlet, and this will lead to a backup of bile and cause extreme pain and leads to inflammation of the gallbladder itself. Since it's a storage pouch, that inflammation presents as a constant severe pain in the right upper or mid abdominal region and may refer to the right upper back, the flank, or the shoulder area. Symptoms often appear 30 minutes after a fatty meal and at night. Symptoms include nausea, vomiting, indigestion, bloating, gas, and belching. And people at higher risk for developing cholecystitis include women, older adults, obese people, and people of Scandinavian, Native American, and Hispanic descent. Pancreatitis is inflammation of the pancreas. It is caused by obstructed gallstones, alcohol abuse, or other diseases. It presents with severe pain in the upper left and right quadrants, often radiating to the back. The patient may report that the pain is worse after eating, including nausea, vomiting, abdominal distension, and tenderness. Sepsis or hemorrhage may occur. In these patients, you want to look for fever or tachycardia. Appendicitis is inflammation or infection in the appendix. This can also cause tissues to die, causing an abscess, peritonitis, or shock. Pain is initially more generalized, dull, and diffuse, and may center in the umbilical area. Pain then later localizes to the right lower quadrant. Then those signs and symptoms include nausea and vomiting, anorexia, meaning lack of eating, fever, chills, rebound tenderness, and that's a result of peritoneal irritation. That's assessed by pressing gently down and firmly on the abdomen. A patient will feel pain when the pressure is actually released. GI hemorrhage, bleeding within the GI tract, can be acute. It may be shorter term or more severe. It also can be chronic, may be longer duration and less severe. All complaints should be considered serious. These can occur in the upper or lower GI tract. Bleeding in the upper GI tract occurs from the esophagus to the upper small intestine. Hematemesis, meaning blood in the vomit, is frequently seen in patients with upper GI bleeding. Lower GI bleeding occurs between the upper part of the small intestine and the anus, and it often manifests as melena or dark tarry stools. Esophagitis occurs when the lining of the esophagus becomes inflamed by infection or acids from the stomach. Gastroesophageal reflux disease, GERD, is a condition in which the sphincter between the esophagus and the stomach opens, allowing stomach acid to move up into the esophagus. It is also referred to as acid reflux disease. This can cause a burning sensation within the chest, aka heartburn. A patient may report pain in swallowing. Additional symptoms include heartburn, nausea, vomiting, and even sometimes sores in the mouth. It is important to know that occasionally esophagitis and esophageal reflux disease can easily be what the patient thinks they have when they're actually having a heart attack. So we like to do a full assessment, including a cardiac assessment and a respiratory assessment, whenever we're dealing with any type of upper abdominal discomfort. Esophageal varices occurs when the amount of pressure within the blood vessels surrounding the esophagus increases. When that blood flow is blocked in the portal vessels, they dilate. They cause the capillary network of the esophagus to begin leaking. If the pressure begins to build, the vessel walls may fail, causing massive upper gastrointestinal bleeding and hematemesis. And when we say massive, we're talking a lot of blood being vomited out at one time. Initially, the patient shows signs of liver disease like fatigue, weight loss, jaundice, anorexia, edema in the abdomen, abdominal pain, nausea, and vomiting. Gradual disease process can take years before the patient feels discomfort. Rupture of the varices is much more sudden. There's sudden onset of discomfort in the throat, severe difficulty swallowing, vomiting of bright red blood, and copious amounts of bright red blood, hypotension, and of course, signs of shock. Mallory-Weiss syndrome is the junction between the esophagus and the stomach tears. This can cause severe bleeding and possibly death. Other primary risk factors include alcoholism and eating disorders. Prevalent in older adults and older children. Vomiting is the principal symptom, and in extreme cases, patients may experience signs and symptoms of shock, upper abdominal pain, hematemesis, and melena. And by the way, melena means black tarry stool. Gastroenteritis is a very common infection combined with diarrhea, nausea, and vomiting. It can be caused by bacterial or viral organisms, often enters the body through contaminated food or water, can also be caused by non-infectious conditions such as adverse medication reactions, toxin exposure, or chemotherapy. Diarrhea is the principal symptom in both types. Signs and symptoms are large dumping type of diarrhea or frequent small liquid stools, diarrhea containing blood or pus, abdominal cramping, nausea, vomiting, fever, and anorexia. Diverticulitis was first recognized around 1900 when the amount of processed foods eaten increased. The consistency of stools became more solid, requiring more intestinal contractions, increasing pressure in the colon. Bulges in the colonic walls result from the increased intestinal contractions, and then fecal matter gets caught in these bulges and bacteria gather there. Those cause the inflammation and the infection. Main symptoms include abdominal pain on the left side, lower abdomen. Signs are fever, malaise, body aches, chills, nausea, and vomiting. Hemorrhoids, those are created by swelling and inflammation of blood vessels around the rectum. They may result from conditions that increase pressure on the rectum or irritation of the rectum. Increased pressure may be caused by pregnancy, straining at stool, and chronic constipation. Diarrhea can also cause irritation. It'll present as bright red blood during defecation. There's minimal bleeding very often and easy to control. Patients may also experience itching and a small mass on the rectum. In the urinary system, cystitis is bladder inflammation. It is very common, especially in women. It's often secondary to the fact that women's urethras are much smaller and closer to the bladder than the male urethra. Cystitis is also referred to as urinary tract infection. It's caused by a bacterial infection. Often there will be lower quadrant abdominal pain or pressure. It may report an urgency and frequency in urination. Can become a serious problem if the infection spreads to the ureters or kidneys. Kidneys play a major role in maintaining homeostasis. They eliminate waste from the blood. When the kidneys fail, uremia will result. The waste product remains in the blood, urea. Kidney stones can grow over time and cause blockage. You will get calls for kidney stones. They're extremely painful for men especially. Women also do get kidney stones, but men have a tendency to get more. Crystallized chemicals in the urine. It causes blockage that leads to swelling, and the pain is caused by the stone moving within the ureter. A stone may pass on its own or be surgically removed. Acute kidney failure, a sudden decrease in function. It can occur from hemorrhage, dehydration, trauma, shock, sepsis, heart failure, medications, drug abuse, and kidney stones. Often it's reversible with prompt diagnosis and treatment. Chronic kidney failure is irreversible. It's progressive, develops over months and years, often caused by diabetes and hypertension. Kidney tissue shrinks and functions diminish. Eventually, dialysis or transplant is required to remove waste from the bloodstream. Symptoms include altered level of consciousness, seizure, coma, lethargy, nausea, headaches, cramps, edema in the extremities, and the face. Female reproductive organs. Gynecologic problems are a common cause of acute abdominal pain. A lower quadrant pain may relate to the ovaries, the fallopian tubes, or uterus, and we will be studying more in gynecological emergencies under Chapter 23 in 11th edition, Chapter 24 in the 12th edition. Other organ systems, the aorta lies immediately behind the peritoneum. Weak areas that result in abdominal aortic aneurysm, like a AAA, is difficult to detect. We have to use extreme caution when trying to assess or detect an AAA. Development of an aneurysm is slow. If the aneurysm tears or ruptures, massive hemorrhage may occur. Pain may be described as tearing. Handle the patient gently during assessment and transport. Do not palpate the abdomen aggressively. Pneumonia, especially in the lower lungs, can cause ileus and abdominal pain, particularly in young children. So sometimes kids don't present necessarily with difficulty breathing or with any type of chest pain. They'll present with some abdominal pain and not able to have pooped for a couple of days. A hernia is a protrusion of an organ or tissue through a hole or opening into a body cavity where it does not belong. Hernias can occur as a result of the following. It's a congenital defect. They were born around with that. In the umbilicus, for example, a surgical wound that has failed to heal properly. So any of those laparoscopic type surgeries, potential for hernia exists. A natural weakness in the area, such as in the groin. Hernias may not always produce a noticeable mass or lump. Reducible hernias pose little risk and can be pushed back into the body cavity. That doesn't keep them from popping back out again, though. Incarcerated hernias cannot be pushed back in and are compressed by surrounding body tissue. And that prevents usually because it is part of the intestine that is pushing through, then fecal matter can get stuck within that herniated part and continue to fester and not be able to move and create an obstruction so that they're not able to continue to be they're not able to vacate their colon. So that becomes a problem with the obstruction. Strangulation of that incarcerated hernia is a serious medical emergency because then part of that colon is going to die if it does not get relieved immediately. Blood supply is compromised by the compressed surrounding tissue in that situation. Serious hernia signs and symptoms include a formerly reducible mass that is no longer reducible, pain at the hernia site, tenderness when the hernia is palpated, red or blue skin discoloration over the hernia. Now, in your secondary assessment of the abdominal system or the GI system, positioning of the patient may give clues to the nature of the illness. A patient with appendicitis may draw up the right knee because that's more comfortable. A patient with pancreatitis may lie curled up on one side. Physical examinations, normal abdomen is soft and not tender to the touch. Pain and tenderness are the most common symptom of an acute abdomen. Localized pain may give clues to the problem organ. Muscles of the abdominal wall may become rigid involuntarily. This board-like muscle spasm is called guarding. The following steps will help in the abdominal assessment. Explain any procedures to the patient. Place the patient in a supine position with legs drawn up and flexed at the knees. Expose and visually assess the abdomen. Ask the patient where the pain is most intense. Palpate the abdomen very gently. Gently palpate all four regions of the abdomen to determine softness or guarding. Note whether the pain is localized or widespread, and look for patient response after palpating. Determine whether the patient exhibits rebound tenderness, meaning when you press down and release, the pain is upon the release of the compression. Determine whether the patient can relax the abdominal wall on command. Guarding and rigidity may be present. Notably, when palpating the abdomen, always start away from the actual complaint of pain. So if the person complains of the right upper quadrant discomfort, begin your palpation in the lower quadrants. Vital signs you'll check for respiratory rate and pulse rate. And of course, a high respiratory rate with a normal pulse rate and blood pressure may indicate improper ventilations. A high respiratory rate and a pulse rate with signs of shock may indicate septic or hypovolemic shock. If a patient has a dialysis shunt in his or her arm, avoid taking a blood pressure in the same arm as the shunt to avoid damaging it. Although you cannot treat causes of acute abdomen, you do want to take steps to provide comfort and lessen the effects of shock. Treat for shock even when obvious signs are not apparent. Low flow oxygen may decrease nausea and anxiety, potentially, more as a placebo effect. There's no mechanical effect associated. Do try to maintain their O2 level at 94% or above. After releasing the patient to the hospital staff, clean the ambulance, the equipment, and your hands very good, particularly if they are experiencing a gastroenteritis episode. Dialysis emergencies. Dialysis is the only definitive treatment for chronic kidney failure. Dialysis filters blood, cleans it of toxins, and returns it to the body. If the patient misses dialysis treatment, pulmonary edema can and will occur over a period of time. Some services transport patients to and from dialysis centers. The dialysis machine functions much like normal kidneys, except for they do have some adverse effects because of dialysis, including hypotension, muscle cramps because of electrolyte changes, nausea and vomiting, hemorrhage from the access site, and infection at the access site. Also, not all patients go to a center for dialysis. They actually have peritoneal home dialysis pretty commonly up here for chronic kidney patients that are in chronic kidney failure. Additionally, dialysis patients may, if they are taking dialysis at a dialysis clinic, they are often provided with some anti-clotting medications, and those can increase bleeding for a short period of time afterwards, after the dialysis treatment. So, emergency care: manage your airway, breathing, and circulation. High flow to if indicated. Manage bleeding from the access site. Position: sitting up in case of pulmonary edema. Supine if the patient is in shock. And of course, transport promptly. I would like to remind you that there are several questions at the end of all of the PowerPoints, and it is a good opportunity to test your knowledge of the information that you are learning, and just another way to gather more information for passing your future National Registry EMT examination. All right, we will talk to you in the next chapter. Thank you so much.